Well, hello and welcome to our third Health on the Plains coffee hour of 2026. Today and continuing on the third Wednesday of the month through October, I'll get to spend an hour with you all, my cup of coffee, and a great guest that's doing wonderful work promoting health and supporting rural communities. Now, we know this time doesn't work for everyone, so we will be recording this conversation. And if something resonates today, we invite you to share with your colleagues when we post that recording. My name is Wyatt Beckman. I'm a senior analyst and portfolio strategist at the Kansas Health Institute, and I'm thrilled to be the host for this series. The Kansas Health Institute is a nonprofit, nonpartisan educational organization based in Topeka. We believe that evidence-based information, objective analysis, and civil dialogue can inform effective policies, programs, and interventions for healthier communities. This series is built on the idea that nuanced conversations with thoughtful people can help us better understand the many factors that shape rural health. And with that better understanding, we can all work to envision and implement more effective strategies and policies with and in our rural communities. And we're excited to have one of those conversations today. Our guest today, Floribella Redondo-Martinez, has been wrestling with a key question that we're going to wrestle with today for many decades. That question is, what are the key factors shaping the growth and impact of rural community health workers and community health workers in general? Floribella is co-founder and chief executive officer of the Arizona Community Health Workers Association and a nationally recognized leader in advancing the community health worker profession, or CHW. If you hear us say CHW, we're talking about community health workers. She began her career as a promotora de salud in 1990, educating farm workers in Arizona and California on topics ranging from HIV prevention to chronic disease prevention and management. With more than 30 years of CHW experience and 25 years developing bilingual, bicultural CHW programs, she's championed sustainable, equitable, and community-led health systems in rural and underserved communities. She's played a leading role in the statewide movement to secure Arizona's community health worker voluntary certification legislation, helping establish a pathway for workforce certification, professional advancement, and sustainability. We're going to talk about that some today. Her leadership also includes service on Arizona's CHW Voluntary Certification Advisory Board. She's chair of the Arizona Community Health Worker Coalition. She's a core member and of the National CHW Core Consensus Standards and a founding board member of the National Association of CHWs. And to continue, past chair of the APHA CHW section. She's helped develop Arizona Western College's CHW certification program and to this day remains committed to strengthening CHW leadership, workforce sustainability, and opportunities for women leaders. Floribella, thank you so much for joining us. And I'm really excited to take all of that experience and all that expertise and bring it into our conversation today.
Thank you so much, and good morning, everyone. Floribella Redondo, like Wyatt said, I'm so happy to be here. We had a small chat yesterday, but we talked about the cafecito, and that's really important. Like Wyatt said, I'm in Arizona. I've been a CHW for 30 years, but one of the most important things is I've been really a person that has seen the need in our communities and really looking at our culture and how to really move forward. And I'm really happy to be here today and really talk about the CHW, which is my world. Really, I have a life, but I think CHW world is what everything that I have, and I really love what I do. I enjoy working with my colleagues. I enjoy working with allies. I enjoy working with everyone and really looking at the changes of our landscape, our environments, and really moving forward. So happy to be here today, drinking our
Awesome.
cafecito.
Yeah, and you mentioned cafecito and it for those here in Kansas, it's 10 a.m. here. Might feel early. It's even earlier for Floribella. It's just past 8 a.m. So I hope you've got your coffee and yeah, tell me a little bit about the cafecito. We've got our coffee this morning, but cafecito is something you have incorporated into some of your work, and it's maybe a good starting place to sort of orient us to where you're at and some of the communities you serve before we dive into all your work as a CHW and all the policy and system stuff. Maybe the cafecito, we call this a coffee hour. I think a lot of good conversation and a good learning can happen over a cup of coffee. So tell me about that cafecito events you do.
Well, thank you for asking because when I saw the name of your podcast, it's oh man, it's not only us, the culture, our Hispanic culture, specifically the Mexican culture. We all come around the coffee in the morning. In the morning, the coffee is not only just to wake up, it's really to connect with our families. We're always around the cafecito one. That's part of the culture, which we have been incorporating not only in the programs that we do, but also in our communities that we serve. We know that our communities love the cafecito as well. And so our programs incorporate cafecitos, which means that every single week, every 2 weeks, we bring together our group coalition, seniors or whoever we're going to be serving in that project, and we talk around the cafecito about the needs, about the challenges, but also about the opportunities and the vision that they have for their own community. So cafecitos is really a gathering and a connection for all of us.
That's awesome. And I think that that theme of gathering people together, really listening to the needs and the vision and the hopes and the challenges is a theme we're going to keep hearing as we talk about the work of a community health worker and the work you all have been doing as an association. But I think we need to take a step back because we're going to talk a lot about those policies and the systems and the infrastructure change. But there may be folks here that are less familiar with what a community health worker even is or what a community health worker does and the skills and services they bring to their community. And as we mentioned in your bio, you said this is your world. So tell us, for those that may be less familiar, how would you describe a community health worker? What is it that they do and some of the services they can provide?
Well, I'm going to tell you what I believe a CHW is, and then I'll tell you a little bit of how APA frames it, right? So for me, the CHWs are the heart of the community. And how APA frames it, we are the trusted frontline public health professionals. And all of that is really comes to say that we're members of the communities that we serve. We share the same language, the culture, live experiences, and sometimes we live in the same communities as the families that we're supporting or working with. So I think the building of the relationships that we have all the time, they're rooted in the value on the social service, on the trust that we have from a community, but also on serving as the bridge for those individuals that don't have an opportunity to raise their voices or don't have the knowledge or even knowing about the resources that they have in their own community. So CHWs really help people navigate care and essential resources. We really focus on the social part of the individual's life. As we all know, maybe 80% of that is social service or my health, and maybe 15-20% is the direct care that I need. And a lot of the services that CHWs are really focused on the other 80%, which is really the essential that we have, about the housing, about the resources that they need, access to care, where is food, how to get to my doctor's appointment, all those things that we provide every single day. And of course, every single community is different. And the services that CHWs provide are very similar in scope and practice, but really different in the delivery of. So not all, and not, there's not one fits all, but I think that we can say that if we really root our care and our service and the core competence and skill of the profession, then we'll really see who CHWs are and where we fit in the systems.
Yeah, yeah. A couple of keywords I heard, and I love your framing. The heart of the community as a very succinct way to think about where
Mhm.
community health workers fit in. And I heard keyword being trust and bridge. And I before we sort of think about how community health workers fit in with some of the broader healthcare landscape, and I I want to sort of step back and and invite you to share a little bit about some of how you got into community health workers profession, because I think you bring all of that experience and that trust and that bridge building you did. So maybe share a little bit about and you continue to do some of that work and how you got into to being a community health worker, because I think that that sets the stage for how you have approached your work at the association level and across the state. So maybe tell a little bit about your background in getting into this profession.
Well, Wyatt, thank you for asking because you and I did not talk about this, but I work as a farm worker for 23 years. So I was a farm worker myself, working in the fields of Arizona and California. So when I was invited to be a promotora de salud, back in 1990, I was like, what is that? Well, is you're going to be helping your colleagues, you're going to be informing them about the resources. I said, oh, I already do that because I was the only one that spoke English back in the fields. So I was the connector without knowing that I was a promotora de salud. I was connecting them with the resources that we had in our communities. And when inspectors came to check on the crews, I was a translator and I was always there, but I didn't know that I was doing that I was doing the work of a CHW. I was just the individual that knew how to connect and how to communicate. So I that's how I began really working in the fields and educating my peers on HIV, STDs. That was my first project that I worked in, and I was just a colleague. But later on, I was the lady that brought the condoms, right? So I was always like the one that people were started looking for and asking questions, and I had a lot of women interested that before we had never had conversations about any of protection. And then later on, after they saw that I was able to communicate about specific issues and diseases, they came up and they were really open and asking questions. So I really became that bridge between the research and community, but also in communication and the opportunities to learn about prevention in our communities back then in the 90s. That was a big thing.
Mhm.
That's how
Yeah,
I began in this field.
yeah, that's awesome. And it sounds like there's a element of you were already doing a lot of that work, but it was recognized that you could build on that skill and that trust and the relationships that you had. And so thinking about that and your experience and how you've continued to grow in the profession, and we think about as the profession has grown, I think a lot of us likely have experience, whether we want to or not, with the healthcare system, you know, and we can picture what a doctor's office looks like. We can picture what a dentist chair is like. We know nurses, and we sort of see how that maybe works together. It's complicated, but we kind of see how it works together. Some folks on this call likely have interacted with CHW, but community health workers, but maybe not everyone. So thinking about the role of a community health worker, the skills they bring, how do they fit into that broader landscape?
Well, I can tell you that CHWs, we have always been part of the system, but without being recognized.
Mm,
But really, CHWs fit in the broader healthcare landscape as trusted members of the community and the families that they serve. And we and the community system, we're always educating and bringing resources. So when we come to a community and we connect with individuals, families, we are the ones that are referring them. We are the ones that we're helping them do a phone call, make an appointment, ensuring that they have the transportation, and we're ensuring that they understand what they need to bring to their appointments. Or which if it's a healthcare, if it's a social service, they always have to be prepared. And we always try to help them to be prepared for that. At the same time, we also like to make sure that they understand that we're not just there for one visit, but that we're there to continue supporting them after they go to their appointment. If it's a medical appointment and they go to their appointment, we come back and we check on them and say, did you go to your appointment? What did the doctor say? Well, were you able to get your medications? Do you need transportation to get your medication? Do you have somebody that can go get them? Do you need support? And all those things that people need that a lot of times we don't think about, CHWs are there to really fit the need of the individuals. At the broader system of the health system, the CHWs are bringing people into the doors of those clinics and preventing the ER visits by ensuring that CHWs are ensuring that the patients and the clients are really going and attending our office visits with a doctor and taking their medication. Then we're preventing the ER and really reducing the cost of our health system. More and more, we're seeing that CHWs are recognized and trusted and valued as part of the care team. However, there's still a lot of work to be done to ensure that there's a spot, there's a place, there's a system that is incorporating them in the integral way that they should, and without losing the skills and the core of who they are as community health workers that impact their communities they serve, but also that impact the health systems that are serving their community. So when CHWs think about a system and community, we've been working around this for a long time, Wyatt. We think about linkage models. So the CHWs are really linking community with health systems, with health departments. So the linkage model is really something that is really important to understand, and the value that CHWs bring into that linkage has been very successful. There's a lot of documentation, a lot of data that proves that. And one of the things that I say, where do they fit? CHWs really fit in every single level of the health system, community level, system level, and policy level, everywhere. We fit and we're working in those areas.
Yeah, thanks for talking through all that and the and almost correcting the question is not where do they fit in one spot. It's maybe the better question is where do they not fit. But the you also emphasize the challenge in a lot of cases is about the system supporting and enabling those skills and that expertise to be put to use. And we're going to talk a lot about those system challenges. And the other thing I want to sort of put in our minds as we move forward, you alluded to this balance that I think we'll wrestle with, and we're wrestling with at the state level, and I think the profession is thinking about is how do you support and grow the profession, which often comes with things like certification and reimbursement and defining curriculum and standards without losing the core of that community grassroots soul that's there, that heart of the community piece, and how can you hold on to both? And I think we're gonna keep coming back to that. Uh, Before I move forward, I want to remind folks in chat, if you have a thought, a question that you want to ask Floribella, put that in chat, and we'll bring that into the conversation. Um, before we dive into some of those policy and system infrastructure pieces, I think sometimes it's helpful uh, to hear and to be able to picture what does this practically look like in someone's life. And you've been doing community health work for years. Is there a story and you that you could share that is a good example of here's where someone was in need of our services, and I can show you how much of an impact a community health worker had in that person's life, in their family's lives, in that community.
Yes, and I so many stories come to mind, but one that has never really left my thought because it was one of the first stories that we really documented and of the impact of CHWs. I think that I mentioned this before. We've always worked since I began as a CHW. we've always been in connection and working with the University of Arizona. So this project that we had was the first diabetes program for the Hispanic population in Yuma County, and it was the first program offered in Spanish. Before that, we had many of our communities being diagnosed and they as when having diabetes, and people are started saying us, "Oh, the doctor told me that I have sugar." And then some said, the doctors told me that I have a little bit of sugar. And that's how they really reframe how they understood the diagnosis. And one of the things that we started working is really bringing the education and identifying somebody that could actually come, an expert that can actually come and provide the information in Spanish, because we were just beginning. We were not trained on diabetes yet. We were just bringing out the information. And one of the areas that we saw there was a big barrier and challenge was around communication, because there was a diabetes educator at the hospital, and then how the way that individuals got diabetes education was that they had to call this number. At this number, there was an individual that answered, and that individual connected with the health educator, diabetes educator at the hospital. So that individual was actually a translator. So the individual community was talking in Spanish. The individual in the middle was talking in English to the educator, and back and forth. Was that was the education that communities really got back then, and not even think about what other challenges they were facing. So just having said that, one of the first cases and stories that we thought was about this individual that started coming to our support groups, to our diabetes education, and talking about diabetes, healthy eating, exercise. Back then, that was like the core of things that we needed to talk. And this person, this lady, stopped coming to our group, and then we started like, but she was really bad with her diabetes numbers, glucose numbers. She was not getting her medicine. She was not even calling friends. So one of the CHWs went to look for her, and when she got there, she saw that her house had burned down. And one of the things that happened is that when it burned down, what her son died. So when she found the individual, she was living with a family member, and she went to visit. That individual had not gotten out of her home, or that home that she was staying, for weeks or months already, because we were not even knowing what was going on. We just know that it took us a while for us to find where she was at. And she was so immersed in depression, so depressed, that the CHW started coming to work with her 2 3 times a week, communicating, just visiting, just listening if she needed to talk, just being there if she needed to just have somebody there without talking, until the CHW started being able to have a conversation with the individual. And when this lady started like opening up and started getting all the grief out, and the CHW saw, now CHW was able to say, uh, we understand, we're here, all the things that you say, but also, how is your glucose levels? Have you been checking yourself? Long story short, the CHWs continue working with this individual, visiting for weeks and providing more information, support, bringing her, if she didn't have any food, bringing her some food to her home as well, and connecting her with other support groups. After a few months, that individual was ready to leave the house. And the first place that she left to go visit was the support group that we had. She didn't share her story with all the whole group until almost a year after. It was such a really challenging time, not only for the CHWs, because it was the first encounter that we had that had a death involved, and it had not only the death but also challenge of managing a chronic disease that was really uncontrolled. And not having a lot of resource back then allowed us to understand that there was a lot of challenges that we still had, that we need to learn a lot more, and a lot of training need to happen for us to be prepared. So those challenges not only provide support to the families and the individuals that we serve, but also allows us as a profession to understand where there's gaps in the services that we provide, where there's opportunities for us to learn more and cross train, to be able to be more prepared and have those tools to be able to better serve our community and do the best that we can for each individual that is in front of us. So I think that CHWs are always encountering this type of stories, and we need to continue looking at what are the gaps in serving those individuals.
Yeah, what a powerful story, and thank you for for sharing. And I think it's a you pointed out that how meaningful those services were, and I think about the how what that must have meant to that individual to have that support, to have that care, that service. But you were also thinking this tells us something about our profession and the training. We learn from that. And so I want to sort of transition us in our conversation now to talk about your association. And we've talked about those skills and expertise that community health workers have and ways they've demonstrated it. But you co-founded a whole association and you serve as the CEO, and you're celebrating your 25th year of the Arizona Community Health Workers Association. Congratulations on 25 years. Uh, Tell me, what was the impetus for developing the association? What were you hoping to achieve? What was the gap? What's the origin story for the association?
Well, it was in 2001. Again, the University of Arizona thought about bringing us together. The whole, they brought together promotoras de salud, CHWs, and CHRs, community health representatives. And we met in Tucson, and we were just meeting to talk about the projects that we were all working on. And it was the first time that I actually met with other individuals outside my community, and to talk about the services that we were providing each one of us in our communities and the resources that we had. So we really connected, but we also understood that there were so many challenges. And while we're talking in 2001, that was only phone calls. Okay, so there was no Zoom, no nothing. It was phone calls. And we started like talking on that meeting about what are the challenges that you have. So what do you do for that challenge? So we decided to continue after that meeting, continue conversations. It was like 15 of us that came together. And of course, having no funding, having no structure, having no support from organizations, to really come together again in person, because everything had to be in person. We started thinking, okay, how about we continue connecting and have those calls, and I don't know why you're really young, so I don't know if you remember that when you had phone calls and meetings, we have those speakers, or and we connected and we tried to see that in and try to understand what everyone was trying to say, but it was a disconnected, right? So we started meeting on, and is eventually on the phone calls, we heard less and less and less individuals coming into the calls. And to me, there's another friend, my colleague, my co-founder, she and I, who said, you know what? We need to do something. We know how much we learn from each other, but we cannot let it die. So we started saying, okay, let's start talking about specifics. So we brought a topic and we invited everybody to we phone calls. Say, hey, we're gonna have this call and we're gonna be talking about this. It would be nice if you can come in. And we'll have them in Spanish so you can actually understand. So had some in Spanish, had some in English because the CHRs did not speak Spanish, and Promotora de Salud, many of them did not speak English. So we had to have two and started connecting with both. So eventually we got some back, but later on it's like, no, this is not working. I need to start looking. And one of the things that I did was go knock at the state. And there was a friend, she was actually the diabetes manager for the state of Arizona. And I went, I said, Carmen, this is happening. I need support. Can you give me money? And she said, Flor, there's not a lot of money right now, specifically for meetings and things. But I said, but this is about the CHWs, the promotoras. I wasn't even using the workforce. It was just about the groups, the CHW promotoras and CHRs coming together. We're talking, and it's been so important. So she agreed and she gave me $3,000 in 2003. That was the first time that I was able to put it. And as I said, an annual meeting, so an annual meeting for to bring CHWs together. And we were able to bring 19 or 20 individuals together again in Tucson. So that was such a great success and such a feeling of we accomplished something. But not only we accomplished coming together, we accomplished on understanding what are the barriers for us to continue communicating. We accomplished also the barriers that we saw and the challenge that we had as organizations, community grass organizations, but also as promotoras de salud, as CHWs, as CHRs, and how many of the challenges had to do for us to continue growing and understanding and connecting was our own managers at our systems, at our organizations. They did not understand the value of us coming together. They did not understand the value and the investment of that 1 hour conversation we had on phone calls. So that's really when I started to see how can we really understand, how can we start developing education for our managers to understand that what I learned from you is very valuable for my own organization that I'm representing. So that is really when we started working around bringing it together and structuring about building. And pretty soon it was only my co-founder and I that were doing all the work and trying to invite people to come. And later on, it started like coming in and just getting into like a 2 or 3 meetings a year. Not very much, but we never let it go. We never let it go because we saw that it was value in unity, value in information, value of coming together, value in understanding and identifying challenges and barriers, but also value in raising our voices together.
Yeah. Yeah. Thanks for sharing some of the background, and I think the value of bringing the voices together is maybe part of what is in the thinking with where I want to go next. And there's a question from Shelby in chat, and it's almost like she's looking at my notes here because I wanted to ask you more recently. You know, you're 25 years of the association, but in the last handful of years, you developed a rural specific program, and that's the Rural Arizona Community Health Workers Workforce Development Network. And that was in 2019. So you'd had several years already as an association, but then you said we need a program specifically for rural. So what was that? What was the thinking behind that, and what gaps or some of the rural specific challenges were you trying to address with that program?
Thank you for that question. One of the areas that I have to say is that when we developed the association, majority of our members were rural communities, but we didn't understand the value of rural communities because we were all rural back then. But then because we wanted to reach the whole state, we kind of started going into Phoenix and Tucson and getting more connections, but we started in the rural areas because the majority of the CHWs, CHRs and promotoras were from rural communities. So when we started and we grew ASHA and became the state association, but we always had that rural component and rural connection. We all the organizations that were working around structuring and strengthening the CHW workforce in Arizona, we had a lot of years working together, and many of them were rural. So in 2018, we started thinking about how can we really strengthen our rural communities, because we had seen the shift and we had seen the interest on the CHW workforce and profession, not only around Arizona, but around the nation. More and more organizations started and associations, coalitions started to grow. And we thought if we don't really focus on the strengths that we bring, because many of us were from the beginning, organizations were already involved in strengthening the association and network at the state level. We started looking for funding. I said, and then this opportunity came. Said, oh, let's apply for a 1 year pilot program to bring a network together of rural communities. And the first grant that we got to bring the network was really to bring together organizations that had been working in rural communities, that had already seen the challenge, that had already seen the barriers for to care, and they lived in those areas, so they were part of the systems, but that they were supported, but they were also part of the families that were facing the challenges. So we came together and we identified handpicked organizations that we knew they were going to be very strong in the advocacy and policy and developing that information for everybody else to understand what challenges rural communities have. We have so many strengths and values that we have in our rural communities. We have so much that we can offer, but people don't, basically, a lot of the systems and policies do not seem to understand and to look at the value that the rural communities bring to our overall systems in our
Mhm.
state. So
Mm.
when we started raising the racial network and started inviting individuals, we identified two universities that had been working with CHRs in the north, Northern Arizona University, and then the one that had always been with us, University of Arizona. And we had so much already, so much data, so much already written about the value of CHWs, but we needed to extract the value of the CHWs in rural communities specifically. So we started extracting the value, the resources, the opportunities, but also facing the challenges and barriers that we've seen. And specifically in the clinics, health systems and rural communities were really challenged and were really facing the loss of a lot of the funding that they had. So they were letting go a lot of their staff. But CHWs that had worked in systems and the clinics were looking for another job inside organizations. So we're kind of connecting the organization, the services of the health system with the community level. And we knew that there was a strength there. So not only about building that, but also identifying opportunities, because the association was already working around the certification, the sustainability, and we wanted to make sure that we had a really a strong opportunity to advocate and move policy for reimbursement of the rural CHWs that were working in our rural communities as part of that net. We started as part of a network. And that's how we really began identifying those and facing those specific rural barriers, but also specific rural solutions that we might identify.
Yeah, there's another question from Shelby, but I want to sort of first expand and sort of dig into. You mentioned a couple of times policy and systems work, and you touched on a couple big areas of that that I think work together that happened around this time, and that's certification, and then building towards reimbursement and that financing piece. So let's talk about certification first, because this is something that Kansas has in the last handful of years also pursued and enabled. And for you all, it was 2018. You passed legislation, but then took a few years to get in place. But you established a voluntary certification process, and you were really involved in informing that work, talking to policymakers. When you think about the importance of certification for CHWs, what did you learn from that process of establishing the certification, and sort of how did that play into the later work to overall bring sustainability to community health workers?
Well, and thank you for that question again. I think that it's so important, but certification did not just happen, right? Certification took a long time to start planning it and putting it together. And as I had mentioned in our conversation, Wyatt, every single thing that has happened in Arizona has happened with CHWs leading it. For this, before we began even thinking about submitting legislation, I spent 1 year going around the state, meeting with CHRs, meeting with promotora salud, with CHWs, providing training, capacity building to organizations, and gathering the voices of the workforce. So based on that report that I was able to put from that year, we were able to put 10 recommendations when we submitted legislation. And of course, we always think about the CHW sustainability and how CHWs need to be paid and how CHWs want to get paid and get good salaries. And yes, all of that, yes. But one of the things that we saw when I went that year and I asked for the CHW input and we put the 10 recommendations for the state, it was the CHWs, the first two things the CHWs needed was the respect from other professions, from other providers, and the recognition as a profession. Before they went into a good job, salary, those are the first things, two things that they needed. And in our recommendations, you will be able to see that. So one of the areas that really took us a long time was because still to date, and we talk about integrating CHWs into health systems, into working with providers, there are so many providers out there that still don't know who CHWs are or the value that CHWs bring. So back then, when we were working with our legislators and we were talking about, we met with many of them before we submitted. So we submitted the application, and summaries. There's a summaries application in Arizona that you have to submit to inform them that you're intending to submit a legislation. So before we submitted our summaries application, we met with some state senators and with state reps, and we talked about the CHWs. We informed and we educated them. It was really important, and as today, we met with many of them that were Democrat because on the other side they were not busy. They were busy. They didn't want to meet with us. And we pushed forward. We pushed forward and we met and we submitted an application. The first application that we submitted based on the need of the CHW workforce and the intent and the voices that we have gathered, it died on the House. It died right away. It didn't pass. So we came back and we met and we found a champion. We found a champion. It was Senator Heather Carter. She's a Republican and she was us in the Senate. And we talked to her and we told her why. And we told her, educated about the CHW workforce. And one of the things that she said that it was always was so neat to hear this is, oh, if I would have just known about the CHW workforce when my mom was so sick and I needed somebody to come and visit her, that would have been a game changer. So definitely, I will be your champion. So based on that champion, we were able to continue submitting, and the second time, and she was our champion. She opened the file and she did a lot of representation and talked about the CHWs and in every single um, session that we went to and be present. And we not only that, we brought CHRs, promotoras, CHWs, CHW organizations, health systems, everybody. We filled the room of individuals that we're supporting. Of course, there's always individuals that do not support, and that was one. There was the chair of the health committee did not want our bill to pass the second time and did not want to hear the bill. So one of the things what I did was I waited until one day we went to testify, and she did not want to hear anything. So I just waited until outside the building until she came out, and I asked her, why don't you want us to submit the bill, or why don't you allow us to pass, to hear it at least? And she said, because I don't think that there's a need for another workforce. And I said, well, we are here already. And I said, we're doing all this work. If you give me 15 minutes in your office, I can bring you all the data. I can bring you all the things that we need to provide you, so you can see the importance of the vital role that we play in the health system. After a while, she said, okay, I'll give you 15 minutes. Call my office. And they give me 15 minutes. And according to her on the appointment, when we went, I got two of my colleagues from the University of Arizona. The three of us went with a bag of papers and information and data that we had collected, and we met with her. Why? It took us 1 hour and a half of conversation with her. She did not give us 15 minutes. She gave us an hour and a half. And after that, she said, okay, I will allow your bill to be heard. And when that passed, when it went through, she didn't vote. She didn't vote either or, but she let it fly. And Heather Carter was the one that pushed it through. So that's how we got our bill heard. But the bill was put based on the work and the voice of CHWs, the CHWs guiding the process, the CHWs guiding the committee, and letting us know what they needed for their workforce, for their profession.
Yeah, it's a good example. I think it speaks some to Shelby's second question about part of the work was uh, continuing to build those relationships, to have those conversations with the folks that are informing these policies and making sure, in the case of the rural communities, that those perspectives are represented. We're at 10:47, and I really want to sort of think about a key piece of this that we've alluded to. It, part of the story of Arizona and community health workers, and in Kansas as well, relates to reimbursement. And you you had a process to develop reimbursement pathway through a state plan amendment. Kansas has something similar. If we sort of jump forward to now, and I think that there are some strengths to that, and certainly sustainability and reimbursing the services that are provided. But are there still challenges with reimbursement and finances, and thinking about moving forward, and especially for those rural communities, what are some of the challenges that are ahead that we can think about in Arizona and in Kansas and our rural communities to try to continue to make progress when it comes to financial sustainability for CHWs?
There's so many challenges, and I think the when we got the state plan amendment and we were able to get those three famous codes that we have, and a lot of individuals that were not part of the conversations that we had and all the processes that we had to put together. I think that a lot of organizations were really hopeful that, oh, we're going to have reimbursement procedures. It's not that easy. It's not that easy. The state has, at least in our state, our Medicaid office, which is Access, uh, they have so many challenges and allowing, because I'll step back. When we got this amendment and we got the three codes, we were working at the same level, and providing and educating CHW organizations and working with the access staff on developing the CBO provider certification. So many of our CBOs have been able to become providers for this state. However, if we think about being a provider, there are providers for the state under the guise of our state Medicaid office. But when we think about the codes and the opportunity for reimbursement, first of all, the funding that we get for each code and the percentage rate is really low. We need to up that, first of all. It needs to be upped. Um, the other thing is that for CBOs to be able to bill and to get reimbursed, they have to have the referral or the process signed by the health provider, which has become such a challenge for CBOs and providers to be understand and to contract with CBOs to sign off on those referrals and to be able to be billable. So I think there's going to be a lot of challenges. I believe also that certification, which in Arizona certification is licensing. There's no such thing of certification and licensing. It's one. And so our CHWs in Arizona, they're licensed CHWs. So and we didn't know that when we submitted voluntary certification, we thought it was going to be voluntary. It wasn't until the process was almost complete that we met with our state office, and they said, oh no, there's no such thing as certification. In Arizona, certification means licensing. Is like, what? Okay. But that's what their state Medicaid had requested for us to have to be able to even think about reimbursing CHW services. So they have to pass through this certification or licensing to be able to be billable services. So there is a lot of opportunities. I think that CHWs likely to have these licenses because they have been recognized as licensed CHWs on their title. They have certified CHWs, so they're important ways of seeing this as a really great opportunity, but also at the same time, it's a big challenge because we should not be thinking about billable codes as a sustainability mechanism for the CHW workforce. We need to start thinking about what is the whole picture? How are we going to sustain CHWs? Of course, there's always going to be those small grants, big grants that we can tap into, but also what are the other braided blended funding that we can actually bring? What are the contracts that we can actually have with the health plans, MCOs? What are the other opportunities to really build under, if you're a qualified health center, a health system, if you change some of your coding, you can actually bill for some of those codes as well. So you can actually not only depend on the value-based purchasing, but also really looking at the whole picture. How do you integrate it and how you really sustain the workforce? So, like I said, it's still a lot of things that we have to do. And one of the biggest challenges that we have in Arizona is that provider signing off on that referral to get billable, to be reimbursable, reimbursement. But one of the areas that we have been working in the past, I think almost a year, is we're trying to get our state to do um, to change the coding and try to see if we can have a standing order for CHWs, for the CHW services. Because if you look at the services and the codes that we have, they're really only this prevention social services, the education that we're already doing, all the things is nothing on direct care. It's so a standing order would really allow for those organizations to bill for the services that CHWs are providing without having to wait to get a contract with a provider. So we're in that place right now. Like I said, it's been a challenge. It continues to be a challenge. Not it's been here for us. I think it's really important to say that every single step of the way, every single thing that has happened has been guided by the CHWs themselves and the workforce.
Yeah, and a key thing I heard in that I think is informative for us in Kansas thinking about how we move forward and continue to support community health workers is that reimbursement is an important piece, but it's we can think more broadly and more holistically about this entire system, and education and certification and training is part of that. Partnerships across the state, the infrastructure that comes with coalitions and associations are part of that, and reimbursement through Medicaid, but also other types of financial avenues are also something to keep thinking about. And I think about our rural communities, and I hope some of the folks listening to this have really heard about the value of community health workers and are interested, if they haven't already, in thinking about what would it look like to explore having a community health worker on our team and as part of our work. And part of the work you all do at the association, from what I see, is help provide education and training to support those folks. We're running up on our time, and I think there's a lot of resources you all share on your website, but especially for those folks that maybe are hearing about this and say, I this sounds more complex than maybe I thought, and there's a lot here, and we've just scratched the surface. And I want to learn more about community health workers and how they can be part of helping communities be healthier. Or I want to explore some of the information about how they can improve outcomes. What resources would you recommend folks explore as they leave today and want to follow up on some of what we've talked about?
Well, and I apologize why was not able to put a list of resources to provide you in advance, but I will send you that. But one of the things that I would say that every single state right now, almost all of the 50 states have a CHW coalition, a CHW network, a CHW association, or even groups really informing themselves and really organically organizing to make a movement to address the CHW workforce challenges that we have. So there's a lot of information out there. I would say that please visit those associations in your state, those organizations, because I like I mentioned before, every single state is going to be different. Opportunities are going to be different. And we want to make sure that the resources you get are really in tune and aligned with your needs.
Mhm.
So there's a lot of the government offices as well that have information, but I would say start with your own state and reach
Yeah,
out. Reach out. I'm always here. You have my contact information, and one on one. If you want to talk a little bit more about specifics, I would be happy to talk to you and really provide you more resources. Wyatt, I will be sending you, and I know the time is almost ending, but I will be providing you with some of our tools that we have developed so you can actually see if you really think about those codes, if you really hone on those codes and start putting a strategy together, how much money you can actually bring a year for per CHWs. I have that information. I will send it to you. Not this week because I'm in grant writing mode and this is my deadline this week, but I'm probably by next week, all right, I will be sending that information to you.
that sounds great. And my colleague Rebecca dropped some links from some of the resources you've mentioned in chat. I also want to acknowledge my colleague Shelby Rao. She's done some great work on CHW policies here in Kansas, and in our recap that we'll post with this conversation, we'll attach some of our work and the blog post that Shelby wrote, as well as those resources you mentioned. I I thank you so much for taking the time. Thanks for waking up early to join us
Oh,
in grant season and share some of the story and the ways that community health workers have made such an impact in Arizona. Before folks hop off, I invite you to give us your feedback. Let us know what types of conversations you'd want us to have in the future. And when this recap is published, please share it with those who could benefit from learning from Floribella's experience and expertise and story. And Floribella, thank you again for joining us, and everyone
Thank you.
have a good rest of your day.
Thank you. I appreciate it.